Did you know your skin might be trying to tell you something about your blood sugar? Here's a shocking fact. Nearly 1 in 3 people with diabetes don't know they have it. Your skin might be giving you warning signs right now. In today's video, we're exploring 10 diabetes-related skin conditions that are often missed or misdiagnosed. These aren't just cosmetic issues. They can be critical warning signs of an underlying metabolic problem. Stay with me for the next 10 minutes. It could literally save your life or the life of someone you love. Sign 1. Dark, velvety patches in skin folds. These dark, velvety patches appear in body folds and creases, most commonly on the neck, armpits, and groin. They signal that your body is struggling to use insulin properly, a condition called insulin resistance. Nearly 75% of people with these patches either have diabetes or are at high risk for developing it. You're more likely to notice this sign if you have darker skin or carry extra weight. Sign 2. Light brown spots on shins. These light brown, scaly patches appear primarily on the shins and are sometimes called shin spots. They happen when high blood sugar damages small blood vessels in the skin. This is actually the most common skin sign of diabetes, affecting up to 55% of people with the condition. Don't worry, these spots don't hurt, itch, or open up, and many people mistake them for simple age spots. Sign 3. Shiny scarred patches with visible blood vessels. These begin as raised, reddish-yellow patches that eventually transform into shiny, porcelain-like scars where you can see blood vessels underneath. While rare, these patches are strongly linked to diabetes. About 75% of people who have them either have diabetes or will develop it. Be careful with these, as they can break open into painful ulcers that take a very long time to heal. Sign 4. Waxy, tight skin on hands with stiff joints. This condition makes the skin on your hands become tight, waxy, and thick, with stiffness in your finger joints. It happens because excess sugar in your bloodstream binds to collagen in your skin, causing it to harden. About 30% of people with type 1 diabetes experience this. Here's a simple test. Try pressing your palms together flat in a prayer position. Having trouble doing this could be a warning sign. Sign 5. Yellow bumps with red halos. These small, firm, yellowish pimple-like bumps surrounded by red rings are often itchy and typically found on the back, buttocks, and limbs. They're actually fat deposits that appear when your blood fat levels are extremely high. This sign typically shows up when diabetes is seriously out of control. If you notice these bumps, seek medical attention right away. They indicate dangerously high blood sugar and fat levels. Sign 6. Sudden, painless blisters. These large, painless blisters appear suddenly, typically on the feet, legs, or forearms, with no obvious cause like burns or friction. Doctors aren't entirely sure why they happen, but they're strongly associated with diabetes. Though uncommon, they're a distinctive diabetes warning sign. The good news is they usually heal on their own within a few weeks without scarring, but their appearance should prompt you to get your blood sugar checked. Sign 7. Yellowish patches around eyelids. These yellowish, slightly raised patches around the eyelids are actually cholesterol deposits and can signal high blood fat levels. While not exclusive to diabetes, they appear more often in people with diabetes due to related cholesterol abnormalities. Research shows that nearly 30% of people with these eye patches have or will develop type 2 diabetes. Sign 8. Recurring skin infections. Frequent bacterial and fungal infections, especially in warm, moist areas like underarms, beneath breasts, or between fingers and toes, can signal diabetes. High blood sugar weakens your immune system and creates a perfect breeding ground for infections. People with diabetes are twice as likely to develop skin infections compared to those without. Watch for common issues like athlete's foot, ringworm, yeast infections, and bacterial infections that keep coming back despite treatment. Sign 9. Wounds that won't heal. Cuts, scrapes, or sores that take weeks or months to heal, especially on the feet, are a major red flag for diabetes. High blood sugar damages blood vessels, reducing blood flow particularly to your extremities. Diabetic foot ulcers affect about 15% of people with diabetes and are the leading cause of non-traumatic foot amputations. Never ignore a wound that doesn't start improving within a few days, especially on your feet. Sign 10. White patches of skin. These are patches of skin that lose their color, creating white spots or patches with normal skin around them. This happens because your immune system mistakenly attacks and destroys the cells that give your skin its color. People with type 1 diabetes have a higher risk of developing these white patches because both conditions involve immune system problems. Studies show that people with these white patches have a 10 to 15% higher chance of developing type 1 diabetes. While many signs on our list connect more to type 2 diabetes, this one has a stronger link to type 1. What to do if you notice these signs. If you've spotted any of these skin changes, here's what to do. First, don't panic. Having one of these signs doesn't guarantee you have diabetes, but it does mean you should get checked. Schedule an appointment with a healthcare provider for proper testing. They'll likely run an A1C test, which measures your average blood sugar over the past 3 months. While waiting for your appointment, monitor what you eat, particularly reducing simple carbs and sugars. Increase physical activity, even just through daily walks. Stay well hydrated. Take photos of your skin changes to show your doctor. Remember, early detection makes a massive difference in diabetes management and preventing complications. Finally, your skin is speaking to you every day. Learning to listen could save your life. Whether you've noticed these signs on yourself or a loved one, taking action now can prevent serious complications down the road. If this video helped you, please hit the like button and subscribe for more health information that could make a real difference in your life.